Dr. Rahul, when we talk about modern healthcare, these five-star hospitals, the rationale that is almost always argued is that you are able to cross-subsidize for the common man by charging more to foreign travelers or to people who can afford to pay more for healthcare. But the disease incidence is so high that all the hospitals are already bursting at their seams. So how much of this is really possible on the ground?
I don't know how much about whether hospitals are bursting at their seams in this current scenario. But coming to your question, yes, when people come here from various countries, obviously the charges that we are actually giving them is far cheaper than what they are getting out there. So from their perspective, yes, it makes sense. And obviously what you said, yes, we make that kind of revenue which will actually help us in offset the cost for the deserving people. So it's like a sort of a Robin Hood theory. We take from them and then we give it to somebody else. So I don't see anything wrong in doing that, provided we all kind of look at it from the same angle. Because generally there is again at that point of level, at that point of treatment, there is a very strong competition which is going on within the industry. I recall maybe 10-15 years back there was a talk where they was planning to standardize the rates for medical value travel across the board in Kerala. But I'm not sure whether that happened or not, because I remember many hospitals pitched in and put in their tariffs. It was actually not the government, they made a brochure. But somehow somewhere that kind of fell flat. So if we are able to iron out these sort of issues, I think then we'll be on a winning wicket where all of us can march together in a very synergized fashion. Because right now there seems to be some bit of fragmentation when we are working on this.
Can you really focus on medical value travel when a state like ours, when we have such a high disease burden, we are not able to give resources for our own patients? How are you going to promote? That's a very valid question. So you have to also talk about promoting medical value travel with a social responsibility. So when I look at why should Kerala promote medical value travel, the number one aspect which I think about is job creation. Like all of us sitting here, if you just add mathematics, the number of, we're easily, all of us together, I would say about 15,000 employees collectively we can have. That's the power of what healthcare as a services industry can provide for jobs. Then we should also wonder that why are Malayali nurses stuck in conflict zones? Why are our nurses seen in news stories in Yemen, in Libya, in Syria? Why is it happening that? They're all economic migrants. The legacy what we have in Kerala is that Kerala, the healthcare, whether it's a transplant or anything, is the lowest in India because of our healthcare workers. We have that clinical competency to lower the cost. So then comes the point which you asked and what Rahul was trying to do, cross-subsidization. If you want to pay better for your healthcare workers, the maths need to add up. The only solution for all of us here is to attract medical value travelers to our state, so you can cross-subsidize your domestic population, attract more investment, bring in more technology, train your people. All that will happen if you have a focus, a strategy towards MVT. Otherwise, I don't see that happening.